Dr. Justine Lee is an emergency critical care specialist. And that's where I want to begin. How do you know that it's critical? So you walk into your bathroom, just unassuming, and you see a bottle of something on the floor. And you see the dog right there wagging the tail back and forth. Look what I ate. And ate half of those pills. Do I run to the emergency clinic right then? Do I first look up the pill and see if it might be dangerous to my dog? Do I wait until the dog gets sick? What do I do?
Great question, great question. You know, what I normally recommend doing is, first of all, moving your pet into an area of safety. So you want to get your dog out of that room, and then you want to investigate what they got into. So actually looking at the prescription vial, I can say about 50% of the calls that we get at Pet Poison Helpline and Animal Poison Control based out of Minneapolis are actually human medications. So regardless of how well you think you pet-proof your house, we always worry about the altered metabolism that dogs and cats have. They can't metabolize medications that you and I take normally, so we always want to keep those things out of reach. When in doubt, always call a veterinarian or an animal poison control for help right away.
Some medications that are for people, many medications that are for people, are for pets as well. The thing is that there's a certain dosage they're supposed to take.
Yes.
So, well, you name the medication, you can do a better job. I mean,
sure, something like aspirin.
Okay, so aspirin could be dosed or a non-steroidal for a dog.
That's true.
But not the whole bottle.
Well, sometimes just one NSAID, however, can kill a cat. So
a cat, yes, absolutely.
Yep, so you do have to be careful. Even something like naproxen sodium or Aleve, very common non-steroidal anti-inflammatory that we take all the time, even one pill can cause acute kidney failure in a medium-sized 50-pound dog. So when in doubt, you never want to give a human medication without talking to your veterinarian first to be on the safe side.
And if your dog or cat gets into something like that, hopefully maybe the cat would be smart enough not to eat it, but that's not always the case.
Right.
So if you even doubt whether they've had it or not, do you still make that phone call?
You do. In fact, when it comes down to it, I always tell people, pre-program your cell phone with your veterinarian's phone number, your emergency veterinarian's phone number, and Pet Poison Helpline's number. And the reason why is a lot of pet owners are frantic when they see that something's happened to their pet, and you want to make sure that you have access to appropriate medical information right away. It is always cheaper, safer for your pet, and less dangerous, less invasive for your pet to be decontaminated right away. It could be something as simple as us inducing vomiting or giving charcoal to bind up the poison versus waiting for your dog to show symptoms. By then it's too late, and it may be a much more expensive hospital visit in that situation.
Or hopefully you determining, okay, well the pet ate that, no big deal.
Right.
Yeah,
when
that would
in doubt,
be the hope.
Yeah, when in doubt, contact a veterinarian to be on the safe side.
What if you get home and the picture is like this? Your dog or cat is very sick.
Yes.
And then you look over your shoulder and you see the pills that your pet probably ingested to make your pet sick.
When in doubt, again, you want to, if your animal is showing symptoms, your dog or cat, you definitely want to seek veterinary advice right away. When in doubt, contact your veterinarian.
Well, there's that old wives' tale, maybe or not, you'll tell me, induced vomiting.
Never induce vomiting without talking to a vet. In fact, that's a great question. And the reason why is there's actually a couple of poisons that animals can get into where inducing vomiting can make them worse. If they're already showing symptoms, if it's an agent that can cause more damage when it comes back up, we never want to induce vomiting. So certain things in the garage, like kerosene or gasoline, transmission fluid, we don't want to induce vomiting because that can actually cause a really severe pneumonia. So I always tell people, contact a vet or Pet Poison Helpline when in doubt before you do anything.
You must be happy about the antifreeze laws that seem to be going from state to state now.
Yep.
And I'm talking about the mandate to include these bittering agents in antifreeze, so the antifreeze doesn't taste so good to dogs or cats, because just a little bit, and you'll tell me how little, can kill an animal.
Yep, as little as 1 teaspoon for a cat or 1 or 2 tablespoons for a dog can cause life-threatening kidney failure. And unfortunately, cats, most people don't know, if your cat gets into antifreeze, you only have 3 hours to treat them before they die of kidney failure. So very, very important to get to a vet right away. The hard thing with the bittering agent, and I totally applaud all the states for adding the bittering agent, remember dogs eat their own poop. So sometimes bittering agents don't always deter them from eating something poisonous.
And it doesn't make it absolutely safe either, from what I understand.
Yes. It makes children less likely to drink it. It makes humans less likely to drink it. For cats, cats have a much more discriminating palate.
Probably cats.
Yeah, but dogs will eat anything. So I always say just pet-proof your house appropriately or your garage. Keep that antifreeze out out of the reach. If you see a puddle of it, make sure to flush it away really well.
And that pet poison hotline number is?
It's 1-800-213-6680, and it works throughout North America. And people can always go to the website petpoisonhelpline.com for more information.
Great. Thank you, Dr. Lee.
No problem. Thanks for having me on.